Good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined today by Dr. Lawrence Lowe, Peel's Medical Officer of Health, and today Michelle DeManuel, CEO of Trillium Health Partners, as well as Sam Rogers, Mississauga's Director of Enforcement, and he's here for any questions you may have about bylaw enforcement. I first want to update residents on some great news that came out of General Committee today. We directed staff to implement a second property tax deferral for Mississauga residents who continue to face financial hardships as a result of COVID-19. We know that many residents across our city have lost their jobs or have been forced to close down their businesses. This deferral program is aimed at taking pressure off residents during this incredibly difficult time. The application-based program will allow residents to apply to defer their property tax payments until December 5th, 2021. I'm very proud of my council and our city staff for getting this done today. All of us know just how important this is, and I really hope that it provides relief to those who need it. Yesterday, Premier Ford declared a second state of emergency for the province of Ontario as a response to the steady increase in number of COVID cases and the dire situation facing our hospitals and our long-term care homes. Among the new measures in place is a stay-at-home order effective Thursday, requiring everyone to stay home except for essential reasons like trips to the grocery store, for medication, healthcare appointments, and of course for exercise. I realize that there's a lot of confusion about what this all means for residents, and I know that the province is actively working to provide clarity on what is expected from our residents. At the city, we're also waiting to hear more from the province on their expectations of cities to enforce this order, as our legal team has not yet received the regulations which lay out the specific instructions. We expect those regulations later this evening. But what gives me great confidence is that I know a vast majority of Mississauga residents are already staying at home as much as they can. And I want to thank you for that. I'm also confident that the vast majority of residents will continue to do so. I do want to make one thing very clear. There is no curfew, and people will not be ticketed for going out for a walk along one of our trails, for shooting hoops in one of our parks, or going out to buy groceries or other essential trips. People will not be ticketed for walking their dogs after 8 p.m. It's the non-essential activities that the province is trying to crack down on. The reality is that for the past 2 months, our bylaw officers have already been issuing tickets to residents and businesses who have been flagrantly and intentionally violating lockdown rules. It's the people who gather in large groups and businesses who fail to comply with the provincial capacity limitations and other regulations that will face fines. The new measures also include reduced shopping hours for non-essential businesses offering curbside pickup, including hardware stores and the LCBO. These businesses cannot open before 7 a.m. and must close by 8 p.m. Grocery stores, big box stores selling groceries, gas stations, pharmacies, and restaurants offering takeout and delivery can stay open later and longer. The province also announced that schools in hotspot zones such as Peel will be closed for an additional 2.5 weeks until at least February 10th. I am happy to report that our skating rinks, parks, and other outdoor amenities will not be affected by these new measures. I know many are struggling to get the kind of physical activity that they need. So I encourage you to use these outdoor spaces to exercise, of course, while following proper physical distancing rules. I do support the new measures from the province because of the recent rise in cases is extremely concerning. We're also seeing an increase in the number of patients who have contracted the much more contagious UK variant of the virus. The province needed to act and to put into place additional public health measures to limit the spread of the virus. In Mississauga, we are now seeing 200 cases per 100,000 residents, while the region as a whole is seeing 260 new cases daily per 100,000 residents. And up until recently, our cases had been plateauing. Unfortunately, we are again seeing increases in the number of daily cases. We know that the province-wide lockdown over the holidays didn't come soon enough, and that the current spike in cases is as a direct result of holiday shopping and gatherings. The new modelling released yesterday by the province painted a frightening picture where we could see upwards of 10,000 daily cases with as many as 100 deaths per day in the coming weeks. Our healthcare system simply can't shoulder this. Michelle D'Emmanuel from Trillium Health Partners will share more information on the dire situation of our hospitals are facing shortly. I'm incredibly frustrated by this entire situation. I truly am. I understand why everyone else is too. We have already been asked to give up so much, giving up seeing our friends and family, going to the gym, to the community centre, or to the library, going to the coffee shop, to our favorite restaurant, or listening to some live music. We've been forced to give up the activities that are so essential to our physical and mental well-being. Our small business community has been completely devastated, with so many shuttering their doors, and some of those forever. People's savings and their livelihoods have been completely wiped out. The lockdown has also taken a huge toll on people's mental health, many struggling with the constant isolation, while others struggle with the uncertainty of what their future holds. And now, once again, we've been asked to dig down deep and do even more. But I'm also incredibly frustrated for another reason: the fact that our provincial and our federal leaders have been unable to provide the proper sick pay leave for so many of our essential workers. The province had an opportunity yesterday to step up and do the right thing, but sadly they did not seize the moment. What's very clear, and we've known this for months and months, is that the virus is being driven largely by workplace outbreaks. 8,700 Ontario workers have contracted COVID-19 from workplace outbreaks. 1,334 of these workers are from Peel region. The region has had 193 outbreaks in workplace settings. 113 of them were from Mississauga. 60% of our workplace outbreaks are happening in manufacturing, distribution centres, and food processing plants. We know that many essential workers who are sick or believe they've been exposed to the virus continue to go to work because they don't have the supports that they need to stay home. The reality is that only 10% of low-wage income earners have access to paid sick leave through their employers. 10%. It's a choice between self-isolation and putting food on the table, and many are understandably choosing to go into work so they can put food on the table. We know what the results of this are: an increase of community transmission. Some have pointed to the federal Canada Recovery Sickness Benefit that provides a net of $450 per week for up to 2 weeks for those who have contracted COVID and need to self-isolate. While any support is welcome, I believe that it is woefully inadequate. First of all, this is an application-based program that can take weeks to get money to the people who need it. It requires someone who might be very sick to take the time off to apply, and they can only apply 1 week at a time. Many temp agency employees also don't qualify for the program, and the benefit is less than what a full-time minimum wage earner makes. It is also completely excludes people who need to take a few days off while awaiting a test result, which could be negative. The program is not accessible to many, nor is it quick at getting people the immediate financial support that is required. This results in many of our essential workers going to work when they're sick because the alternative is taking a financial loss and perhaps not getting food on their tables or paying their rent. This is a glaring gap. Our essential workers simply don't have the privilege, like many of us do, to work from home. And I frankly find it quite disheartening that these workers who keep our economy running are not getting what they need and what they deserve. I've spoken about this urgency of this issue many, many times right here at this podium. Every week for months, the GTHA mayors and chairs have asked that this issue be resolved. In December, Peel Regional Council passed a motion urging the province and the federal government to come together to implement a fund with a more robust sick pay program. And next week, I'm bringing another motion to the City of Mississauga Council that yet again calls on both levels of government to figure this out. Today, I'm strongly urging that our provincial and federal leaders immediately implement 10 mandated sick days to all employees of Ontario to help curb the spread of COVID-19 in workplaces. The province and the federal government need to provide employers with the financial support that they need so that workers can automatically access sick leave. If workers don't feel that they have the financial supports to stay home, there is absolutely no reason why they can expect to see a reduction in workplace outbreaks. I've been calling on this for far too long. The time to act is now. I also want to briefly touch on phase 1 of the vaccine rollout. We've made a great start in Peel, vaccinating more than 15,000 frontline workers, residents, and staff at LTCs. I was also encouraged to see yesterday that the federal government was able to secure 20 million additional doses of the Pfizer vaccine. But like other areas of the province, we are now facing vaccine shortages. This is particularly concerning given that the region of Peel remains one of the hardest hit areas in the entire country. And that's why, along with Mayor Brown of Brampton and Mayor Thompson of Caledon, as well as our regional chair, we are sending a letter to the Premier urging the province to prioritize Peel as more vaccines become available. We know that other areas of the province with far fewer cases than we have received a disproportionate share of the vaccine, and this is unacceptable. The province must ensure appropriate amounts of the vaccine get to the regions that need it the most. The letter will ask the province to support us in creating 2 mass vaccination centres, one in Mississauga and one in Brampton, to ensure that we have the capacity to administer vaccines to priority groups in the next stages of the rollout. We know that Toronto is getting a mass vaccination centre with their 230 cases per 100,000. So it's only fair that our region, with 261 cases per 100,000, also has a mass vaccination centre. Mississauga and all of Peel region have suffered greatly from this pandemic, and I'm doing everything I can to ensure we move past this COVID nightmare as soon as possible. And now, I'd like to invite up Michelle D'Emmanuel, President and CEO of Trillium Health Partners, to give an update on the serious situation that is facing our hospitals. Michelle?
Thank you, Madam Mayor. Hello, I'm Michelle D'Emmanuel, and I'm the CEO and President of Trillium Health Partners. I want to first and foremost always on behalf of the 12,000 workers at Trillium Health Partners thank each and every one of you in our community for what you do each day to both protect each other and also support your hospital. Yesterday, as the Mayor outlined, we heard about some very somber numbers. These numbers represent both significant impacts to our community, to our hospital, to long-term care and more. I know we can continue to count on you to do everything you can to stop the spread of COVID-19. Trillium Health Partners has not had a day without a COVID-19 patient since March of last year, some 10 months. 10 months, not one day. Right now, we are caring for more COVID-19 patients than at any time during this entire pandemic. As of this morning, we had 135 patients in our hospital with COVID-19, 32 in critical care. We have 136 additional patients under investigation just today, so that number will go up. The average age of our COVID-19 patient is 69 years old. We are experiencing an enormous amount of pressure in the hospital. We're partnering now with other hospitals, never in the way we have before. And I want to thank our hospital partners in Halton, York, and Toronto, just to name a few, who have helped us in transferring over 118 patients in the past 4 weeks out of our hospital into their hospitals where there was capacity and less of a burden of COVID-19, as the Mayor alluded to. We've also opened new beds in our hospital with the support of the province, and we are doing everything we can to maintain a safe environment to ensure that your hospital is there for you. Without this work, we would have been more pressurized. Our surgical services continue to be open for urgent and emergent cases. We're operating about 50% of where we were prior to COVID-19. We're also opening more beds in the coming weeks ahead. With that, I just want to remind you, when the last time I had an opportunity and honor to speak to our community, I talked about our overarching plan, and that plan has been activated and is underway as it has been through this entire period, and each and every day we continue to morph and calibrate and respond to what is needed. First and foremost, as our excellent medical officer of health says, it starts with good public health measures, and that's where our plan starts with. It starts with ensuring we're all doing those important things to keep people safe, like distancing, wearing a mask. We're screening at our doors. We're providing all the PPE necessary for our frontline clinicians and patients to be protected. We audit these works that we do. We have coaching constantly to ensure we're upping our game. Keeping people safe is our #1 priority. We also, secondly, have ensured that only the most essential workers are on site at any given time, and that we only have our essential caregivers available in our hospital at any given time. Thirdly, as I outlined, we are providing the services that are essential, urgent, and emergent while working to manage through those daily patient volumes that I talked about. While we haven't returned to our pre-COVID surgical levels, as I mentioned, we are trying to maintain a reliable schedule of surgery to the end of this fiscal year and to minimize any further cancellations. Our last action in our plan, and it's a plan that we share with the guidance of and direction of Peel Public Health, is to eradicate this virus through vaccination. Long-term care is our current priority, along with patient-facing hospital workers and our paramedics. To date, we've administered almost 7,000 vaccines under the direction of Peel Public Health, and we are proud to partner with them. I am sure there is not a person listening or watching today who in some way has not been touched personally or professionally, directly or indirectly, by this virus. Every one of us has an opportunity to play a role in fighting this virus. Every one of us is in the fight of this generation, as I heard General Hillier say earlier today. No act is too big or too small in this fight. I was reminded, Madam Mayor, something Hazel McCallion often says to us, and Hazel is the guardian of our hospital at Trillium Health Partners, and she reminds me that this community built this hospital through individual acts of baking a pie, hosting a raffle, selling used books, and so much more. Our hospital was built by individual acts. Our city can be free of COVID-19 through your individual acts of masking, distancing, following our directions that were given by public health, and now vaccinating to sustain it. Thank you, and please stay safe.
Thank you, Michelle. And now I'd like to invite Dr. Lawrence Lowe back up to the podium to provide his weekly update. Thank you. Sorry.
Thank you, Madam Mayor, Michelle. Good afternoon. Mississauga's test positivity for COVID-19 currently sits at 10.5%, which is flat from last week. And the city's incidence rate of 199.1 cases per 100,000 is an increase from 162.9 per 100,000 last week. We are no longer seeing a plateau in Mississauga. Recent case increases are particularly concerning given the capacity challenges described by Michelle at our hospitals, which continue to contend with significant admissions and ICU demand. Tragically, in our community, deaths are also accelerating, and our thoughts are with those who have lost loved ones in this terrible second wave that is far from over. Yesterday's provincial decision to implement a stay-at-home order is critical to saving lives, protecting our most vulnerable, and keeping our healthcare workers and first responders well. But as we've learned in the first wave, we must do more to support our essential workers. Our essential workers continue to receive, manufacture, and distribute goods that the rest of us rely on to stay home and stay safe. So I ask, if not for our healthcare workers on the front lines, if not for our elderly who remain at mortal risk, if that isn't enough, please stay home for our essential workers. If you are sick, please get tested and then self-isolate, including from anyone that you may already live with. If you cannot self-isolate safely, please call Peel Public Health at 905-799-7700. You may qualify for access to free isolation housing to keep you from infecting your loved ones. One part of the puzzle to reducing transmission is in all of our hands. But there is more to be done. Essential workplaces need inspections, investigations, and protections. Let's get the Ministry of Labour some more resources to proactively inspect high-risk sectors. We need rapid testing in workplace settings. Paid sick days can help workers stay home and self-isolate if they are sick, and protecting our temporary contract and agency workers keeps them safe and stops spread in multiple workplaces if they are unwell. All of this is needed to drive COVID-19 numbers down further and give our immunization program its best shot at success. On that, I know that many in the community are anxious to receive the vaccine, and I am grateful for this enthusiasm. At this time, unfortunately, vaccines are not available for the general public. The province has prioritized those at highest risk: long-term care residents, staff, and hospital workers. Peel Public Health continues to work with Trillium Health Partners and our other hospital and agency partners throughout the region to administer immunizations that will meet this priority. And to date, we have collectively administered over 15,000 doses of COVID-19 vaccine in our region. Before this week is through, all of our long-term care homes and high-risk retirement home residents and many of their staff will have received their first dose of COVID-19 vaccine. And this accomplishment, together with our partners, is happening even while we are all still leading an emergency response. The province has assured us of more vaccine in added priority groups to come, and when that happens, we will be ready to deliver this vital measure to you. As vaccine supply increases, so too will our channels for distribution. But for now, as we vaccinate our most vulnerable, we must also follow the measures that will support our essential workforce and keep transmission down. So, for everyone, I encourage you, please, do your part. Stay home, except for the essentials. Success in the next few months means bringing COVID rates down and pushing vaccine coverage up. And that means that we're going to have to follow the precautions, and when it's your turn, get the shot. It's all in our hands. Thank you, and I'll pass it back to Madam Mayor.
Thank you, and I'm here to answer any questions or ask Dr. Lowe or Michelle DeManuel or our Director of Bylaw, Sam Rogers.
Your first question comes from Isaac Callan at the Pointer. Isaac, go ahead.
Hey, Mayor Crombie, how are you?
I'm well, Isaac. Nice to hear from you again today.
And you. I want to ask first about the enforcement issue. I think there's some confusion, as you've alluded to, about exactly what will be enforced. There was an interesting quote from Chief Pegg in Toronto earlier today where he said that, quote, the best information we have is from a media release. And in Peel Region, I think, again, as you'll know from the work that you did on street checks with the Peel Regional Police, there is a history of enforcement among racialized communities and Black Peel residents where there have definitely been problems in the past. With the increased emphasis being placed by the province on the role of bylaw and policing, while there are still these questions about exactly what constitutes essential and what doesn't, could both you and Sam Rogers speak to how Mississauga bylaw officers will be ensuring that this is policed fairly and equitably and that this doesn't result in an increased emphasis on policing racialized or Black members of Peel's communities?
I have a better quote for you, Isaac. The best information is yet to come. We are waiting for the regs to come out, and that will certainly and hopefully explain what is essential and non-essential trips, but we're asking everyone to use their best judgment at this time. Do you ask yourself, do you really need that now? Can it wait till later? And if it can wait till later, we're going to ask you to order it online to have delivered to your home, or just plainly wait till later. So, of course, we don't want to see any scenario that people are stopped unnecessarily, as we had with the street check program, whether that be by bylaw, what will their role be, or by Peel Police, what will their role be. That hopefully will all be explained in the regulations, which we will receive later. And maybe I'll ask Sam to come up and he can elaborate further, Isaac.
Thank you.
Thank you, Mayor Crombie, and good afternoon, Isaac. Thank you for the question. Yes, still a lot of questions to be answered on our end, and we look forward to receiving, reviewing, and implementing an enforcement plan. I can tell you, with respect to the pending order that's coming, we are having hourly conversations with Peel Regional Police. They will be the lead agency for any type of an enforcement of a stay-at-home order. However, I can tell you that as well, we have plenty of enforcement officers ready and prepared to enforce all of the additional new regulations, some of which have come out now, but the majority of which we're still waiting on. We've gotten very, very good at short notice changes throughout this pandemic, and I'm very confident, regardless of what the regulations that do come out, our staff will be ready to implement a reasonable and balanced enforcement approach. Thank you.
Follow-up?
Shifting gears slightly, property tax deferral. I want to ask a little bit about small businesses. Obviously, Mississauga has taken some steps in the past to help small businesses, things like property tax deferrals and buy local campaigns, which you've been quite instrumental in. But across North America, there are other creative examples of how cities can help out. Some cities have created their own municipal grants. Others have taken voluntary pay cuts within council and helped put some of that money towards local businesses. There are even some US cities which are smaller than Mississauga that have changed their procurement strategy. So they're buying as much as possible from local businesses within their cities. So I just want to know what's been done so far for local businesses in terms of municipal funds, and are there plans to work on using municipal power going forward well?
So, Isaac, you ask a very interesting question because under the Municipal Act, the city is not permitted to provide grants or subsidies or loans to small businesses. So there have been many creative ways and supports. We've supported them. We have a number of consultations with them, and we ask them what they need and what kinds of supports, and we've been advocating to other levels of government. And certainly, I think that the rent eviction is one of those measures that came forward, and certainly the financial support with respect to their fixed costs, including their property tax that came forward from the provincial government, that was the $600 million, was a direct result of that. But in terms of creating some sort of fund that would go to support small businesses, we are not permitted to do anything like that, Isaac. Thank you for the question.
Your next question, Mayor Crombie, comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Mayor Crombie, how are you?
I'm very well, Steve. How about you? Keeping safe and well, thanks. I hope? Good.
I'm trying. Just kind of riffing off of Isaac's first question there on the enforcement piece. Understandably, these regulations are not at your fingertips at this point, or whatever the new ones are anyways, but what would be your hope and kind of philosophy, and perhaps Sam could answer this as well, but for folks who may not, might be experiencing homelessness in Mississauga, and therefore are kind of on the streets or in parks without kind of what I've seen as the outlined essential reasons for being out, like what would be the approach in that situation, your hope, what would be the approach?
Kindness. The approach would be kindness and compassion, and asking them if they wanted a shelter, and we could certainly direct them to a shelter. I don't want to see this new regulation transform itself into some sort of street check program. I do not want our Peel police or our bylaw officers stopping and questioning people as to where they live and where their whereabouts and where they intend to go. That is not the purpose of this, because obviously everyone's going to say, I'm going to the grocery store to visit my mother or drop off medication to her. So I don't want to see that in action. So I think this is yet to be determined, Steve. We'll know more tonight, and this is probably going to be a very active conversation at the region of Peel tomorrow as the regulations will be further explained to us.
Follow-up?
Thank you for that. And I think my next question is for Dr. Lowe.
Certainly, I'll ask him to come forward.
Thanks, Steve. Go ahead with your question.
Thanks, Dr. Lowe. There were some comments today in Mississauga Council around at least a thought or belief that there is some resistance to the vaccine being taken, at least in Mississauga. So just curious what your take is on that. Is there a bit of hesitancy to take the vaccine, and what would you say to folks who might have that vaccine available to them now, but may not necessarily want to take it at this time?
I think there's a recognition out there that many people have questions around the vaccine. And I want to be very clear. I used to work in vaccine safety at the federal level. I know many of the people that were involved in reviewing the data. Health Canada would not approve a vaccine if they were not fully convinced of its benefit, its safety, its effectiveness. We are certainly working as Peel Public Health together with community agencies, community leaders, our hospital partners, healthcare partners, everyone across the community to address hesitancy. But really, it's not. To some extent, it's called hesitancy, but it is about answering questions and concerns that people rightly have about a new intervention, about a new technology. But it is really important for me to stress that the vaccine is safe, it's effective. We look forward to answering questions people might have, but ultimately, to the extent that it becomes more available, it does represent, our best shot at really trying to turn the tide in this pandemic. And I certainly encourage people to review resources available online, to reach out to their primary care providers, to speak to public health at 905-799-9770 if you have specific questions that you can't get answered. we're here to make sure that there's every confidence in the vaccine as it gets rolled out in our community to make sure we can stop COVID-19. Thanks for the question, Steve.
Next question.
Your next question comes from Ashley Newport at Mississauga.
Hi,
Go ahead,
Ashley.
Crombie, how are you?
I'm so well. How about you?
I'm doing well. I wanted to ask another question about workplaces. I know that there was some talk before the announcement yesterday that the province might look at closing some non-essential manufacturing. So I just kind of wanted to get your thoughts on that, and if you think that going forward, especially with so many cases linked to workplaces and essential workers in Mississauga, if you would consider pushing the province to look into potentially temporarily closing any, I guess, non-essential manufacturing, I guess, places that might make things that we don't need immediately, like furniture or cosmetics. Is that something that you'd be considering advocating for in the future?
Ashley, it's an excellent question, and I had wondered whether the Premier would go that far. So perhaps that's in his next phase, but certainly when we have 1,334 workers who have had COVID in workplace outbreaks in Peel, it's something to consider. The ratio is 45% Mississauga, 55% Brampton, so I would think that could be another area they would look very closely at. I wondered, as you did, whether or not that would be part of this additional measures in this lockdown as part of the stay home.
Thank you. And my next question is about today at a general committee, there was a lot more talk about small businesses and, of course, the impact that this is having on small businesses and how, some of them have been closed for weeks now, or been impacted for a long time. And you had mentioned that, you'd be willing to try again to advocate on their behalf. I just wondered what that means. Does that mean you would consider maybe trying for another motion at regional council to call for more restrictions on big box stores, or calling again for them to be restricted in selling non-essentials? Like, what kind of plan do you plan to bring forward about that?
Ashley, I'd be in favor of any plan that would help level the playing field, certainly. And, I feel that the big box stores have a huge competitive advantage right now. And it's fundamentally unfair to our small retailers, our small businesses. And so, I was quite in favor of limiting the non-essential aisle in those big box stores. I would even support closing them down for a period of time. I understand the explanation is supply chain issues. It would affect everyone. But I'd be willing to try it. As you know, that came up at Mississauga Council today, and at the end of the meeting, I, along with Councillor Ron Starr, went back and forth as to what that might look like, and there didn't seem to be a lot of support to actually draft anything specific. So next week at Council may be too late. Perhaps something will come forward at the region tomorrow. I will call around tonight to see if there's an appetite to move something at the region. Otherwise, we have another shot at it next week at Council. I would be very supportive. Unfortunately, as you know, that's not widely supported among my council members.
Your final question comes from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Madam Mayor, how are you?
Welcome, Khaled. Nice to hear your voice.
Thank you so much. Same here. Toronto outdoor ice rinks are still open. What about ours here in Mississauga?
Yes, they will stay open. Anything outdoor recreation, physical activity is encouraged. Of course, you have to sign up. There's a registration program that you have to sign up to ensure your space, because it's very much in demand, Khaled.
Thank you so much. May I ask Dr. Lowe, please?
Absolutely. Dr. Lowe?
Hi, Khaled. Go ahead with your question.
Thank you. As a physician, Dr. Lowe, how do you diagnose a person who's contracted the variant, and what is the difference, and how it is the variant than the normal one we suffer from right now?
It's a great question, Khaled. In fact, as I understand it, the variant was identified on genome sequencing. So basically, they take laboratory samples and they sequence out, they basically try to characterize what the virus's genetic material looks like. So in terms of the actual presentation, we know that COVID-19 already is a spectrum of diagnoses, certainly from people who have no symptoms or very mild symptoms to people who have really, really significant and concerning illness that requires intensive care or requires hospitalization, which is why we're having the issue that we have right now. So the variant's not necessarily something that you can diagnose on spec in terms of diagnosis, but it is something that has been identified through laboratory testing specifically in sequencing the genes. And while I'm on that topic, one of the biggest concerns with the variant right now is that it is more transmissible, which means that if you increase the number of people who contract COVID-19, then out of those, a proportion of them will need hospitalization, will need intensive care, and a proportion of them will also succumb. And if you increase the numbers on those, in each of those categories, we're going to see much more concerning trends in the weeks to come, which is why it is absolutely vital that people stick to the provincial order to stay home as much as possible at this time and really only venture out for the most essential reasons. Thanks for the question.
That concludes our press conference for today. On behalf of Mayor Crombie, I thank you all for joining.